The next topic, what I would like to talk about is the health part. I will cover the initial insurance part and hand it over to my panelist Limi for the next part as well. So in the health system, so we will cover overview of how the healthcare works in Czech Republic, how to access the medical care, and what are the different insurance available for the legal residents, and how to navigate around this topic. It's very, very crucial topic as part of the health system, how to access and how to go through the process. Next slide, please. So firstly, in terms of healthcare, so if you're employed, the health is given to you from the employer. And if you have your dependent, I'm calling in terms of your spouse or partner. So for the minor less than 18 years old, the employer will cover your health insurance. While for your spouse, depending upon your company, it might be covered from, you need to purchase a health insurance, and that can be given from a list of providers. So that's very, very important. The important thing is there are 4 parameters where you need to look at it. One is the coverage requirements, the network of medical providers, policy duration, and any pre-existing condition. So as you travel out from India to Czech Republic, my personal advice is to document your medical report from your existing doctor and bring it in English translated version, and here you can translate it into a Czech, and this has to be given when you register for your GP, that my fellow panelists will cover. But this is very, very important in getting your medical insurance. If you have a pre-existing ailment and you have to declare it to the insurance so that they will tell you whether the insurance premium will go up or down, it's better to disclose right in the beginning than in the middle when everybody gets a surprise and you might say that, oh, this particular ailment is not covered, it's unknown, and then the whole thing starts. So it's very, very critical to have this medical report at the time of buying the insurance. It's very, very crucial and critical.
Thank you, Ramaji. I take this opportunity to thank Indian Embassy. And I'm really happy to introduce the healthcare system, the Czech healthcare system to you all. The Czech healthcare system provides a high quality medical service and includes both the public and private healthcare facilities. It focusing on delivering accessible and quality healthcare to all citizens. The insurance and financing in the Czech Republic healthcare is funded through mandatory health insurance, as you all know. Next, please. We start from, I think this would have covered, this already covered by Pramod. So let's go, yes. No, the first one, GP, yes. So let's see how to find the general practitioner. This is very crucial once we are here. And a general practitioner is your first point of contact for non-emergency medical issues. Finding a GP, it will be important, and register with the GP upon arrival. Some may refuse new patients. So check with multiple clinics, and you could get help from your health insurance company also. So once you contact your health insurance company, they would give you information regarding the GPs who are in contract under different facilities. So GP's referrals are required for most specialties. Visit the GP for minor illness, checkups, and prescriptions. So this is Polyclinica. When to use the Polyclinica? So your first channel would be the GP, and then you go to the Polyclinica for multi-specialty outpatients clinics with specialists such as dermatology, ENT, and gynecologists. Usually require a referral from a GP. As I said, the first person for contact would be the GP. So through GP, you go to Polyclinica with a referral. And useful for non-urgent specialists consultations without hospital admissions. So this is about little bit about the hospital, when to go. Emergency care hospitals provide 24/7 emergency cares, and when to visit the hospital is with the serious illness, accidents, or conditions needing immediate attention. Again, here comes the GP. If directed by the GP or emergency medical service like ambulance, your first and foremost person to contact would be GP. An emergency room, which in Czech we call it pohotovosť, available for urgent medical issues outside GP hours. Now it comes the very crucial thing, which is the pharmacies. We call it lekárna here. They are the main providers for the medicines. The prescriptions required for most medications, I would say 95% of the medications it need a prescription, including antibiotics, strong painkillers, and chronic condition treatments. And yes, you could buy OTC medications, but still, it's only the generic medications such as paracetamols, ibuprofen, antihistamines, and digestive aids like for gas or something. 24/7 pharmacies exist in major cities, but they are very few. Always carry your insurance card when visiting a pharmacy, which is very important, as my colleague, my friend Pramod said, like you need rodní číslo. So your card might tell you your details, so that would be enough for buying from the pharmacy. Now, this is my favorite part, mother and child care. I would say I used to get minimum 2 calls a day to ask, to get the information about how to register to the hospital when they get pregnant, or how to get the gynecologist consultation and all. So let me just introduce the free birth up to 3 years of maternity leave, free daycare, paid medical leave when your child is sick and needed care. Free public health, high schools that are even better than most private ones are free college. Children born, this is from January 1st of 2024. Children born from this date, they are allowed to draw 3,50,000 Czech crowns. Last year it was 3 lakh, now they increased the amount. And this can be drawn up to 3 years of child's age. In case of twins, there would be 5,25,000. And these are the links for more details. And now this is the very emergency numbers for the ambulance services, which we have to keep in mind, because there are numbers like a medical emergency number 155, which they speak only English or only Czech. So the number which is 112 is for European medical emergency number, which they can provide information in English and assist you in English. So the emergency number 112 would be helpful for all of us. And those who speak little bit of Czech, 155. Ambulance is free for injured individuals in life-threatening cases. Always carry your insurance card, which will give you the details of the person. So the final tips for the newcomers is register with the GP as soon as possible you arrive, because you may not know when you get into some kind of illness or some kind of accidents, the first person to contact would be your GP. So if you have to go through your GP, understand your health insurance coverage, which would be either it is comprehensive or complex. So you should understand what is your insurance coverage. Know where your nearest polyclinic and hospital are. Keep emergency numbers saved in your phone. Learn basic Czech medical phrases or use a translation app, which each one of us is using now. Thank you.